Welcome to my world, the world of the medical laboratory scientist. Health is wealth, knowledge is power. Early detection of Parkinson's disease. Yes, you might have heard of Parkinson's disease over and over again, but it is a very progressive disease that starts with tremor, and that tremor gradually graduates to loss of memory and the terminal stage, which takes years. At times, it could be up to 30 years from the beginning of that tremor. But it's also very necessary for one to detect it early. Parkinson's disease has to do with dopamine, where you have lower dopamine in the brain, because there is the nerve that supplies the brain with dopamine. Dopamine is an hormone that helps to really make one feel happy. It's a kind of thing that creates that addiction, and that's why you find it in the drug addicts, because that satisfaction you want to get from anything, it is the level of dopamine that is produced by the nerves, the neurons in the brain, that really creates it. But where you have a situation where these nerves are damaged or destroyed, then there will be lower dopamine, which results in this kind of tremor. And you can understand the tremor that even drug addicts do experience, especially their withdrawal syndrome. That does not explain in the totality, but what we are trying to talk about is Parkinson itself. The Parkinson disease is also associated with other causative agents like viruses, which I shall expose in the slide section. But how do we help people to detect it early so that they can stop the progression, because it's a kind of progressive disease, stop the progression of this Parkinson disease to that terminal stage where there is nothing that can be done, and there is a serious loss of memory, which apart from other disenabler. The slide section will surely expose this CSF, so it's contained in the CSF of people who have this Parkinson's disease, or are the onsets of Parkinson's disease. And so it is something the medical laboratory scientists can always test for, apart from the early signs that is just the tremor. As we move on into the slide session, more exposition and clearer understanding of Parkinson's disease shall be exposed. So, as usual, click the like button, subscribe for more quality production. The outline: objective, introduction, Parkinson's disease progression, laboratory diagnosis, and finally treatment. The objective: to expose the benefits of early detection of Parkinson's disease, thereby slowing down its rapid progression to the debilitating states, and also creating opportunity for early treatment that may help improve sufferers' economic value and may also prolong life. The introduction: Parkinson's disease is a progressive movement disorder caused by the loss of dopamine-producing neurons in the part of the brain called the substantia nigra. Since dopamine is essential for smooth muscle coordination, its depletion causes symptoms like tremor, rigidity, bradykinesia, and gait problems. One significant event is the buildup of alpha-synuclein protein Lewy bodies as the dopamine-producing neurons are lost. Parkinson's disease is often referred to as Parkinson's spectrum disorder or Parkinsonism. It covers a wide range of neurodegenerative conditions with varying symptoms, including Parkinson's disease itself, Parkinson's dementia, Lewy body dementia, an atypical syndrome like multiple system atrophy. The Parkinson disease, you will always notice the first sign has tremor. After that, the other characteristics of progression will be shown in the coming slide. Parkinson disease progression. There are 5 stages of Parkinson disease. The first stage, like I said, is the early symptom, and they are mild and only affect only one side of the body. The tremor or movement issues are usually minor, and daily life is generally not interrupted, but it is just like a partial we don't want to use the paralysis word. Stage 2, mild stage. Symptoms worsen and affect both sides of the body. So the tremor and the movement problem is affecting both sides. Stage 3 is mild stage 2, but increased slowness of movement, bradykinesia, and you notice falls becomes more common. The stage 4 is the advanced stage, often requires a walker, and independence is lost. You must be to do anything. There is no more independence. Stage 5 is the advanced terminal stage. The person is often bedridden or confined to a wheelchair with extreme stiffness in the leg. It could also show some sign of psychiatric problems. Laboratory diagnosis. Just like Eisler observed, the moment the brain cells, the neurons are lost, the neurons that produce this dopamine, they will now find in its place the build-up of this synuclear protein. That synuclear protein is what can be gotten in the CSF, and that's for early detection of Parkinson's disease. The laboratory investigation could be done using that advanced biomarker test. It is specific to Parkinson's disease. Then the skin biopsy is another one. Relatively new test that analyzes small skin samples from the nail, the neck, and the ankle to detect phosphorylated alpha-synuclein in the nerve fibers. So it's almost similar. That is what is done with the CSF that is collected for the alpha-synuclein seed amplification assay. Yes, there are other causal agents sort of associated with PD, Parkinson's disease. Just as written as last year, 2025 study identified the human PEGI virus as a potential environmental trigger for Parkinson's disease. So if one can probably use that to also, though it's not in itself confirmatory yet, but the finding that the virus in the brain of 50% of Parkinson patients studied compared to none seen in control is suggestive that it could be a signal, not necessarily the cause of the degeneration, the neurodegeneration, but it could be a signal. And this human PEGI virus is a common, previously considered harmless blood-borne virus. And other viruses that we could probably test will include influenza and HSV are also debated as potential less common trigger of this loss of the neurons producing this dopamine. Finally, treatment. Treatment is not my special area of concentration, but what do we do with early detection? That's where I have to say many things about what next. While there is no known cure to completely stop or reverse Parkinson's disease, once it is detected early, detection is crucial for early detection is crucial for initiating therapies that can significantly slow its progression, manage symptoms, and maintain a high quality of life for many years. Number one, the best thing to do is to see a movement disorder specialist, a physiotherapist or a neurologist specializing in Parkinson can offer advanced, up-to-date treatment option. Research shows that regular high-intensity exercise is the closest thing to a cure for slowing Parkinson progression. Hydration is also very necessary, that one should not lack water. Diet and lifestyle is another one. Certain medications like razaglin, seleglin, and the agonist, the dopamine agonist, which is a level dopa usage will also help. It is like passing or injecting dopamine, so you're taking dopamine itself to boost these happy feelings, as well as allow the smooth muscles to really perform smoothly and not the tremor that we see. Eating plenty of fresh vegetables, just like the Mediterranean diet, fruits, berries, nuts, seed, fish, omega-3 fatty acid, and olive oil, just like all the recommendations for balanced diet or the Mediterranean style of diet will go a long way to slow down this progression into these later stages of Parkinson's disease. There are so many videos, as I've always been saying on in this my channel. So many videos, over 222, or probably this would add more. And you now can look at any health issue, especially where the laboratory involvement is needed. You want to know what laboratory tested. So this is you are in a safe place. But as usual, click the like button, subscribe, so that more quality production could come from my side. Well done.